All right, in this video, we're going to go over the brief identification of the muscles of the leg. Then in later videos, we'll actually go over each of their insertions, actions, and origins. So we're going to start with the glute muscles first. This large one is going to be the gluteus maximus. We're going to remove it so you can see the gluteus medius, which is number 12 right through here. Then we're going to have 13, which is the gluteus minimus. We're going to rotate the leg to the lateral view. And here you're going to see number 18. This is the tensor fasciae lata or the tensor fasciae latae, depending on where you come from. This attaches to the IT band. This is the iliotibial band. So make sure you note that for the exam, we will ask for the tensor up through here. So we're going to rotate the leg to the anterior view. And here we'll go over the quadricep muscles. So the quadricep muscles are going to have the rectus femoris in the front. Then we're going to have three vastus muscles. We're going to have the vastus lateralis. And so note that this is the knee. Since we're in the anterior view, this is the lateral muscle of the knee. And this is going to be, this vastus medialis is going to be on the medial portion of the knee. So let me go ahead and rotate this forward. So the last vastus we're going to focus on is vastus intermedius. And we're going to pop out this muscle. And this is going to be the vastus intermedius muscle. Note that it was directly south of this major muscle, which is going to be the rectus femoris muscle. Let me go ahead and pop the rectus femoris back in. This is the rectus femoris muscle right here. So we're going to rotate the leg toward the medial side where you will see the sartorius. So the sartorius goes from front of hip all the way down through here to the inside knee. Next, we're going to show you the adductor longus muscle. This is the adductor longus muscle. We're going to rotate again so you can see the gracilis muscle. There's this nice big one right here. Note that it goes from inside hip to inside knee. Next, we're going to rotate a little further and we're going to see the adductor magnus. And if you look at the cadaver, you'll notice it's much more meaty. So it has more mass, it's more magnificent, right? So we're going to rotate to the posterior view now. And the posterior view of the leg, we're going to look for medial orientation and lateral orientation. Okay, so we're going to have the bicep femoris, and you're going to note that the bicep femoris has a long and a short head. 31 is going to be the long head, and we're going to pop it out so you can see the short head. And the short head is going to be number 32 right through here. So again, it's on the back of the knee, it is posterior. So I'm going to go to the semitendinosus. That's number 30 right through here. And it's the more superficial posterior muscle. Right underneath that is going to be the membranosus. Okay, and it goes the entire length across here, but it's underneath this muscle. So membi, tendi, and then I joked the bicep femoris would go right through here. So now we're going to go a little lower on the leg, and we're going to go through the calf muscles and the muscles of the shin. So let me go ahead and pop this puppy back in. Okay, so we're going to rotate to the front of the leg, and we're going to note about four major muscles. So we're going to do some orientation. Again, we are anterior. This is the tibial bone, the tibia. So we're going to say that this is the tibialis anterior muscle. Next, we're going to have the extensor digitorum, and we're going to know that extensor digitorum longus is going to be this muscle right through here, number 34. Okay. We're going to have the fibularis longus. You may have heard of it as the peroneus muscle. And if we rotate the leg laterally, you'll note that this is the fibularis muscle, or as you may have heard it, the peroneus muscle. And make sure that we're not including 36. We're just going to include this upper portion right through here. Next, we're going to talk about the extensor hallux longus. So hallux, you know from bones, means the big toe. So we're going to rotate to the front. And if you notice, it is a little superficial, but it does go a little deep. And it's not just this tiny little baby muscle, it goes up and actually kind of spreads out a little further, thicker inside the calf. So now we're going to flip to the posterior view. And in the posterior view, you're going to see the gastrocnemius, and there's two heads. So you're going to see 37 is one head, 38 is going to be the other head. And we're going to remove them so you can see the soleus muscle. And sometimes it's a little hard to pull out, so you may have to remove this muscle right through here. And so that was one of the heads that we moved from the gastrocnemius. And now we're going to have 39, which is the soleus muscle. And it doesn't just stop here, it actually goes the length of this calf. So it is under here as well. Lastly, we're gonna have the flexor hallucis longus, and that's gonna be number 43. And we're gonna rotate, actually we're gonna pull off a little bit. It's a deeper posterior muscle, and you're gonna see it right through here. Okay, so it's a deeper muscle in the calf. And that's all of our muscles for the leg.